Now let's start with the section 5 of our lecture, in which we will talk about some other management options for the hearing impaired rehabilitation. We already talked in detail about different hearing aids, conventional type, bone anchored rehabilitation type of hearing aids, and then also different implantable hearing aids, and also the cochlear implants, which is used for the sensory neural type of hearing loss. So now, what are some other devices or other management options for the hearing impaired? These management options include some auditory brainstem implant, assistive devices, and then some training available for the individuals who are hard of hearing. So auditory brainstem implant, it stimulates the cochlear nucleus complex in the brainstem directly by placing the implant in the lateral recess of the fourth ventricle. So now in this, the implant is placed in the lateral recess of the fourth ventricle, and then it stimulates the cochlear nuclear complex. So it's called auditory brainstem implant. This is the brainstem. Brainstem is made up of three structures. We have the pons, then medulla oblongata, and the midbrain. All these structures make up the brainstem. So this is the brainstem. We have the electrode placed in the brainstem, and it stimulates the cochlear nuclear complex. So its electrode is in the brainstem, then this is the electrode, and this is the sound processor, decoding chip, and then we have the microphone. So more or less the components are the same as in the cochlear implants, but the point where the electrode is placed is different in auditory brainstem implant. When cranial nerve 8 has been severed in surgery of vestibular schwannoma. So when cranial nerve 8, which is the vestibulocochlear nerve, which is involved for the balance and hear, is damaged during the surgical procedure of vestibular schwannoma, then we need auditory brainstem implants. Then we have some assistive listening devices and system. These are hardwired system. Then we have induction loops, amplitude modulation, frequency modulation, infrared signals. So all these are some assistive listening devices and systems that helps the individual to hear sometimes or type of sounds too, so they can integrate some communication. So these are all the different listening devices that are used. Then alerting devices like we have doorbells, flashing lights, all these, if you see, these are the doorbells. Then we have alarm systems. These are then devices that can produce lights, flashes, just to alert the individual who cannot hear that there is some type of emergency, or so they can do something to protect them or to alert another individual. So these are the alerting devices. Our clock alarms are also alerting devices included in that. So these are the pictures of alerting devices. Then telecommunication devices. Telecommunication devices are attached to handset of telephone, residential or public, to amplify the sound. So this telecommunication devices just to make the sound, amplify the sound of the telephone so individual can hear better. These are known as the telecommunication devices. They are attached to telephone sets. Then the training, we have training like speech reading, which is by the lip reading, so they can read the lips and then to make up the conversation. Auditory training helps them to listen better, auditory training. And then we have speech conservation. All these are the different training methods which help the individual, especially the children who cannot, so they can communicate better, and that helps them to produce sounds and hear the sounds better, so that can help them to in communication and trying to explain their things better, so they can be better in the for the society and for the environment. That was all about the rehabilitation of hearing impaired, in which we talked about different aids that can benefit the individual who have hearing problems, and if they can, different types depending on their requirement and whether they are prelingual or postlingual. Prelingual is more hard to treat, and they need additional therapies and trainings so that can benefit them. Otherwise, usually hearing aids is not the only mean by which they can improve their hearing. So that was all about our today's lecture. Thank you for watching sqadia.com.